fortunate to have Miss LaTonia Ford coming in and talk to us about health. She is a nurse practitioner and she is a weight management consultant specialist. And she's going to talk to us about what being a nurse is. And then later on, we'll talk about some weight management tips. And, you know, it's a lifestyle thing, all of it together. So, good morning, LaTonia. Thank you so much for being on the show.
I'm so excited. Thank you for having me, Coffee and No Static Radio. Thanks for inviting me and having me this morning.
So, the first thing I would like for you to do is tell us about a nurse practitioner. What is a nurse practitioner and what do you do?
Well, the journey and my journey to being a nurse practitioner started almost 18 years ago at this point. I graduated from nursing school with my bachelor's degree from Ursuline College in 2005, starting as a registered nurse. And there are different levels of nursing. You have nursing assistants, LPNs, registered nurses, and then nurse practitioners. So nurse practitioners have advanced education in nursing, and it's really a mix of nursing and medical practice. Nurse practitioners, you walk in your doctor's office or your provider's office, and you can either see the physician, the nurse practitioner, or maybe even a physician assistant. We all kind of function the same, in which we can diagnose. So you come in with strep throat, we can say, hey, you actually have strep throat. We can order testing, so we can do the swabs, and then order the treatment. So that would be the major differences between, say, a registered nurse and a nurse practitioner, in the sense of we can diagnose, we can assess, and actually order the treatment. Now, with nurse practitioners here in the state of Ohio, we still require that oversight by physicians. We call them collaborating physicians. So that is, one of the legal requirements to practice here in the state of Ohio. So all nurse practitioners do require a physician collaboration, in which you have to be active with in order to practice. To be a nurse practitioner, it requires an additional 2 years of school. So I had 6 years of college in order to become a nurse practitioner. And then personally, I went on to complete my doctorate. So actually,
congratulations!
Thank you. So Dr. LaTonia.
Oh, wow!
Yes.
You know, and you know, sometimes those things can seem kind of bougie to people, but really, to me, when someone says they have a PhD, talk about what that is, because that means that really shows the heightened level of seriousness you had when you decided that this was going to be a profession that you were going to go into. When you listen to history, when you listen to anything, when someone says they have a PhD, that is someone that, to me, with a super heightened level of interest, sincerity, devotion to a profession.
And commitment, right?
Yes. Yeah.
It's a big deal, and it took a long time for me to even decide to go back to complete that. For nurses, it's either PhD or DNP. I chose the DNP route, actually, which is the Doctorate of Nursing Practice. The PhDs more so focus in research. DNPs more so focus in the practice and advanced leadership. So I chose the DNP route, needless to say, still doctorate of nursing practice. But you're absolutely right. It shows a commitment to your profession, a commitment to your craft, a commitment to your career.
Yes.
Because it is not easy by any means. I think it's still important to, know I'm not a physician. I don't want to confuse people and say, doctor.
Right.
But needless to say, I completed that and I'm very proud of it.
Right. And so that's one thing that I've been learning. Again, I created the BlackAnthropy show because I do freelance journalism, and you have editorial guidelines, and a big part of that is the word limit. And so when you talk to people, you know, you kind of decide what you want in there, but then you have an editor that decides what, would be best in the article.
Sure.
And you don't really always get a chance to really tell a person's story the way you want to when you're writing for other people. And so for you to explain that, one thing that I've learned is, as I've started BlackAnthropy and bring people on the show, what their initials after their name means.
Yeah.
And I think now, I had not even heard and realized the difference between what you say, what you have, the D, versus the PhD.
Right.
That is research, because again, I like the well, I guess I like both, but I like the practice.
Yeah.
Because to me, the schools that figure out how to get the students and even people in the community real life experience in a job, because for you to go through school and then wait until you graduate to start working and say, this isn't what I thought. And so the sooner you can practice, though. So how much research did you do versus the practice?
Yeah, there's still a great deal of research between, I guess, the two programs and the 2 degrees. As a matter of fact, the whole purpose in creating the DNP was to bridge the gap. So they say there's as much as 10 to 15 years between research and actual practice. So when you walk into a provider or a clinician's office, what you're getting may not necessarily be the most up to date because we have such a gap. So DNPs, or doctors in nursing practice, were designed and created to help bridge that gap. Okay, so
when were they created?
I want to say sometime in the 90s, and please don't quote me on that. But yeah, that was the whole point, so we have our PhD colleagues, okay, but when do we, translate that to the bedside and in the community? And so that is why I chose the DNP route, the practice, the actual, hands-on, and the translation of practice, of that research. So you bring up a great point with that.
Yeah, and again, that's why I have you on, because if I wrote an article about you, and hopefully at some point, I get to put you in Cleveland Magazine, or theland.org, or even Signal Cleveland here, all of the outlets that I write.
Name them all and put them on there.
Yeah, I'll try. That's definitely what it's about, right?
Speaking into existence.
Yeah. But that is so important. For one, general knowledge and information. We make a lot of assumptions. Again, that's why I have a show, because I want people like you. I don't want to be sitting here doing all this research and that's not my background, and then explaining what people like you have done and experienced and what your life is.
Yeah.
And then, as Black people, when we go to the doctor, do we go to the hospital? I should say,
right?
Because it's just like really what I said. Yeah. When we go to the doctor, we don't even really know who these people are, who is treating us, what their level of education is, what we should expect from them. Right. And so again, that's when you said nurse practitioner. I said when I saw that, because your background and experience, where I was introduced to you, is from the nonprofit organization you work for, and in scrubbing their website and speaking with the founder, Sherry White. I was like, wow, she has a nurse practitioner. Wow. I mean, she's just not doing this cancer work, just fly by night. She actually is doing the way, it's very good to see it being done, surrounding herself with the people who have the expertise.
Yeah.
And I was like, wow. Because how hard is it to get a nurse to come on the show?
Yeah. It matters, right? Just being out in the community and, sharing that knowledge and expertise. You asked me in a previous question, I guess, the differences in the years in terms of the education. So a registered nurse you can become a registered nurse in anywhere from 2 to 4 years, and then a nurse practitioner in about 5 to 6 years, and then the doctorate is another 2 years. So we're talking about 8 years total, of education. So you're absolutely right. Just bringing that expertise, bringing that knowledge and those skills, it helps that it comes, like you said, directly from the person.
Yeah, yeah, so you can learn it, and so you know what you're, or at least have an idea. When you go someplace, you can ask and you can clarify and be like, okay, so this person is doing this, and so you know your expectation is in the right space,
right,
you
right.
know. And so talk about, like what's the experience actually doing the work on a day-to-day basis, because again, I'm sure this is something very informative.
Mm-hmm.
You learn a lot day to day, because one thing that I think I experience a lot when going to the doctors is when they try to generalize everything
Right.
and make it based on what they read or researched versus who I am and what I'm telling you.
Exactly. So, being a nurse practitioner, again, like I said, we function of just like the physicians or the physician assistants, in the office. So when you walk in, um, we take your history, we perform physicals, come up with a plan with you, which may include some sort of, ordering some labs, some additional testing, sending over prescriptions, just like you would in any other setting. It could be, and nurse practitioners work in a variety of settings. So it could be an office, it could be a hospital, if you're ever hospitalized. Sometimes patients, we can see patients at the bedside. We work for insurance companies. We work in policy. We work
That's big.
Yeah, we work in nonprofits, like I do with my Sister's Keeper. So we can work in a variety of settings, and it's nice because like I like to say, nursing and medicine meet. So the heart and function and the passion of a nurse meets with medicine. So where you really get to hopefully connect with the patient and helping them come up, with whatever treatment plan that's best for them. So that's really what it looks like, and you may not even really notice a difference outside of that individual introducing themselves as a nurse practitioner. You may not even really know, but yeah, for the most part, we function all the same.
Okay. And so, when you say you're working under the doctors, do you have? So before you got your what is it called again? The DMP.
DMP. Yes.
So before you got the DMP, or with or without it, how does it work when you're with the supervisor, basically attending physician or something like that? What level of, should I say, for lack of a better word, authority do you have to instruct someone or guide someone or recommend something to a patient? That what do you need without the doctor's permission, and what can you do that the doctor has to approve?
Yeah, so and just so I'm clear, even with the doctorate degree, I still require physician collaboration. It doesn't, take that need away. This is an Ohio law. Okay, different laws have different.
Different states have different laws.
It varies
based on where you're at.
Okay, exactly. So there's actually quite a few states. I want to say upwards of 26 or so states where nurse practitioners don't require physician collaboration. But here in the state of Ohio, we still do. So what exactly does that all mean for nurse practitioners? Okay, it can be as involved or as hands-off, as the agreement is set. It could be simply a chart review.
So you have a written agreement with the hospital?
You got a written agreement with your physician, with your whatever group you're in, whatever hospital system you're working in terms of what it's going to look like. The minimum is that there is some sort of chart review done by the physician, at least once a month, so that they're aware of what their, nurse practitioner, is doing, how they're practicing. It can be as involved in, hey, I have a question about a patient, I would like your input on. So it could actually be collaborative, in a sense, as the name, suggests. And you can get advice, what would you do? How should I treat the patients? In the best sense, that's probably how it should be. Again, it's actually a written agreement between a nurse practitioner and a physician.
Okay. Now, as you get experience, do you end up changing that agreement? How long are those agreements for? Does the physician, is it acceptable for them to just start giving you more, leeway or?
I think it's all individual. Okay, there's a minimum from the state, but as much as you want is again up to the nurse practitioner and the physician how in depth or involved it is. So we actually have a lot of autonomy. Okay, so and you really do work in collaboration. Very rarely has there been a situation where the physician just absolutely did not agree, with something that I may have done. So yeah, we actually have a lot of autonomy in that area.
So then, what are some of the medical issues that you consistently see, like in the community where you work, and then what would be the difference with like? So, what are some of the medical issues that you see, and that people, the big ones that people really don't understand, what's going on or how something happened, and what the recommendations that you're giving them? What are some of the big medical issues that you see out there?
Yeah, so in my practice, I'm in weight management at one of the large health systems here in Cleveland, Ohio. And so I see patients or see people who are trying to lose weight, trying to get healthier. And so some of the conditions that we see that are largely weight related are the high blood pressure, the diabetes, the high cholesterol. There's a lot of misinformation and misunderstanding about those big three, I say conditions. And what I really try to get people and patients to understand is that improving your lifestyle, not only just with losing weight, but eating better, making changes and improving your physical activity actually can help these other conditions.
Yeah.
Okay. Not just adding on prescriptions and hopefully not transitioning to the point where you need some sort of surgical intervention with, heart surgeries and all these other kind of things. If we really focus on these lifestyle, adjustments, hopefully these other conditions, will improve. And so that is where I spend most of my community education in really reinforcing and educating the community on, how can we, make these practices a lifestyle?
Mm-hmm.
What small changes can we put in place to, like I said, improve on some of these conditions, that you may have and that you may encounter.
And so then what do you find people's receptiveness to what you're saying, and like any follow-up, like do they, what do you see as like percentage of people, like if you see 10 people in a week, what percent of them are you seeing, the next week or the next month when you follow up, that they're taking this seriously, even if they haven't begun to take the steps to do the things, but they want more information?
I would definitely probably say more than half.
Okay,
I think people,
good.
People are actually, they're hungry for the information and the education. They're finally, they're happy to finally get the support, that they need, the level of understanding. They may not come back in a month and have completely changed everything.
Right.
But they have certainly, started to take that information to heart. Like, okay, you know what, maybe I can cut back on some of the fast food, that I've been having. Maybe I can come back on some of the sugary beverages that I'm having. I'm down to maybe one pop a week, and here in Ohio and Cleveland, we say pop.
I'm
right?
from Chicago. I know it.
Right.
I know it. Pop. I went to school in North Carolina.
So Chicago says what? What do you got? Y'all say pop?
Yeah. When I went to school in North Carolina, it's like they were like, it's not pop, it's soda. I said no. It actually said soda pop.
Right. I get teased about that all the time. But So it's a lot of people actually they realize, what, I need to start making some changes.
About what age? Because at a certain age, we're not even thinking about our health like that.
Right.
Maybe women, when we're pregnant and things like that, we start taking our health serious. But about what age range do you see people are, changing? And then is there, when people do start thinking that they're taking the easy route by taking the medication, do they start saying, this is getting out of control, I'm taking too much, I need to try to do something else?
Yeah, it kind of starts catching up with you in your 40s, mid to late 40s, early 50s. You're right. Women, we tend to interact more with the healthcare systems and providers earlier because of pregnancies and things. Right, taking our children, those sorts of things. So we probably are a little bit more connected earlier to what's going on. But it's about those 40s, 50s when we're going to our, providers and are saying, hey, you know what, your blood sugars are they're creeping up on you, or your blood pressure, you've been, borderline high blood pressure for a minute, your cholesterol is creeping up. I want to put you on the medication, and they're like, whoa. I don't want to go down that road just yet. What can I do? To prevent that. I don't want to be with 5, 10 medications at 60 years old, right?
And so why do medical institutions, to me, they get to that pill very fast?
Yeah.
And so my cholesterol had gone up, and then it went back down, and then I just went to the doctor, and they said it went back up, and they said, oh, it went up so high, we want to get you on the medication. I said, just a second. Whoa. Yeah. It's about 4 or 5 things that I was doing that I'm not doing anymore. And I need to get back to doing those, and then we'll see. They were like, well, it's really high. I'm like, I understand, but let me, implement, back my exercise, eating my oatmeal, and, incorporating all these other things, do some research on the foods and fruits that I can eat, So talk about it, like, why is there, it seems that the pill is a thing versus, we, trying to learn who a person is and what, what do they eat and what they can incorporate and take out.
Yeah, I think your perception actually is very accurate. Training as a registered nurse practitioner, and I will go so far even to say in medical school, you get very, very, very little education on nutrition, on exercise, on lifestyle medicine. If you get it, it's, maybe a couple hours in some lecture squeezed in at the end, and you're moved on to larger issues and interventions.
Wow.
In order
That's why.
That is exactly why. There has been a push to integrate this level of education sooner and more robust and fuller and more comprehensive in the medical schools and nursing programs. Because you're right, there's feedback from patients and the community saying, hey, we really don't want to just jump to medications and surgical interventions. But providers are saying, hey, we really don't know how to educate people. Okay, what do we say?
We only know how to give people a prescription.
Exactly. I only have this much time to see my patients. Okay, and that's a whole other issue, right? Because of reimbursement and the push to see volumes of people. And then there's also, you have this this stress on outcomes, right? So providers are measured as a population on how they treat their patients. So how many of your patients have their blood pressures controlled? Okay, how many of your patients have their cholesterol levels controlled? How many of your patients have their hemoglobin A1Cs or their blood glucose levels controlled? They're actually measured and watched. You get scorecards on that. As your population, Mr. Jones, how many people you see have levels that are actually in normal value. So you have to answer for that. So if it's not, then what are you doing about that? Okay. So although we want to give our patients time to work on lifestyle, okay, you got these quarterly scorecards coming out saying, okay, well, your cholesterol patients, they're still not to goal. Okay, what are you doing about that? Okay.
And this is so interesting because it sounds like what you're saying is, like a person like me, they say that my cholesterol is high. I go, and it's interesting how, and I'm thinking of this as we're having this discussion right now. So then I said, okay, well, I'm not taking that medication, and I'm going to do some things. So then the doctor or the practitioner said, the primary care physician said, okay, you can go to this website and read this, this, or this. And I'm really thinking about this as I'm talking to you. For one, I had done that before when it first started to creep up. Uh, but then, as I listen to you, I'm thinking that should have been incorporated in the meeting because I had done the test. We scheduled the follow up appointment, and so that should have been incorporated in the follow up appointment. That, okay, the first thing I would recommend is I went to this website, the USDA or the FDA or whoever it is, and they have, the paleo or they have the Mediterranean, and it means this, and these are some options. And if you don't want to do those, we can give you a pill right now. And so it's like, but she left it to me to go and do the research. But now you're saying, and if I do the research, implement that, then she gets credit for my cholesterol going down. When she really,
she counseled you on it, right?
Oh, okay. So, is that what it was?
Right.
Okay.
Yeah. I mean, it's kind of it's a benefit for both, right?
Yes.
Ultimately, as providers, we really do want the best for you.
Mm-hmm.
So how you get there, obviously, is going to be individual. But yeah, she would,
That's okay. That's okay. It's just that understanding what's going on there, because to me it's like I said, I'm not gonna keep beating this up, but it's interesting how they want to say appeal for something versus do these other things, and during the meeting they're not prepared to talk about other things. They're just prepared to talk about the pill, and then doing other things is almost like you said in school. It's almost like the last 30 seconds of the appointment.
Oh, you should lose weight. Oh, you should start dieting, or you should exercise.
And you said 40. Oh, you said 40. Oh, how about 30?
Right.
Yeah. Everything that happens, you're old and you're overweight. It's like, wow. Okay, wait. You had to have learned way more than that in medical school.
Right.
It's like.
Well, and we're finally starting to make the shift now that there is such a spotlight on weight loss with the different medication options that's out there. So providers and hospital systems and organizations and programs are realizing, we probably need to do a better job with this, and that we need to approach it from a team-based approach. The reality is your doctor really doesn't have all of the time, but does it have to be from your doctor? You should probably see a dietitian. You should probably see a physical therapist, an exercise physiologist. There's other people in the team that can support in the plan and educating and counseling and coaching you. It doesn't have to come, from your clinician. So that's what I think is probably the best of both worlds. Maybe the physician or the provider have that conversation with you to kind of like open the door, but you have the other team members that support it. So
okay.
Yeah.
Good morning. Again, you're listening to the BlackAnthropy radio show, and we're talking Health Monday with our guest, nurse practitioner, LaTonia Ford. And one thing I like to do on BlackAnthropy, since we're trying to, provide knowledge, resources, information, and inspiration to people, is I bring on people with basically who are experts in a particular industry or profession. And so you just said a couple of things that I want you to break down. That physiology and dietitian.
Okay.
So what does that mean, right? So if I should be going there and asking for a what? A physiologist? So again, when you're meeting and a doctor says that your blood pressure is high or diabetes or high cholesterol, if these are three big issues, what, before I even get to the follow-up appointment, so I can be prepared with the doctor to talk about these things, because I think it sounds like that's something that's really important that patients should be doing, is preparing so that you understand these other methods that are available and options to you.
Yeah, other options, and again, other team members. So a registered dietitian, they're licensed actually just as nurses are, and physicians, all in the area of nutrition. And they may even have expertise in different health conditions. So they could be, specializing in diabetes or high blood pressure or cancer or athletes. It just kind of depends on sports medicine, what your goal is. So I like to look at dietitians as they help you understand the foundations of food. A lot of us don't even understand like
Yes.
how our body uses food. What does your body do when you eat a piece of chicken? What does your body do when you eat a piece of bread? All of those processes is that it goes through. So dietitians help you in understanding the basic foundations of putting a balanced meal together. So even if you think you understand, I tell everybody you should still sit down with a dietitian. Okay, you can always get something out of it. I talk to dietitians.
Yes.
It amazes me how much information they can share with you. Exercise physiologists are they specialize in physical activity and exercise plans that are specific to health conditions, okay? And health conditions that could really limit your physical abilities. Like I think about those with like heart failure, okay, where you may not necessarily be able to go into a gym safely if you have heart failure, but an exercise physiologist can help you come up with a physical activity plan that fits within your physical limitations and needs. A physical therapist, typically they help with rehab, rehabilitation, regaining strength and health, things like that. But they can also help you come up with exercise plans too.
Yes.
So I would kind of be open to that as well. And I don't expect people to go into their doctor's office and say, hey, can I get a prescription for an exercise physiologist? I would expect maybe, can I see a dietitian? Do you think I should see a physical therapist? I think the average person would do okay with some sort of basic exercise plan.
Yes.
And, a dietitian. So,
now, and then the other part of that, if you can talk about, so again, when you say, I have high cholesterol, I have high blood pressure, what are the things that I can buy over the counter at a local pharmacy that can help me monitor this so that when I go in, so like for me, I think it's interesting that my blood pressure seems to be one thing when I go into the doctor.
Absolutely.
And then when I take it at home, it's only 120 over 80. And so, but what I'm really asking you to talk about is the fact that I even take it at home, that I have something.
Yeah, you bring up an excellent point with that. I look at a blood pressure monitor like I look at a weight scale. It's just a piece of equipment you should absolutely have in your house. Okay, it provides you with more information and maybe even better information outside of the office, because you're right. You can walk in the office, in the doctor's office, and your blood pressure is high. We call that white coat syndrome. There's the anxiety, there's the getting there, I had to find parking, where's my insurance card, and you finally sit down and check your blood pressure and it's high. Well, it's not really high.
Yeah.
It was all of the rigmarole, getting into the office. Like you said, when I'm at home, it's normal. We really like that information. We like that information a lot. So it helps if you have your own blood pressure monitor at home. That's one piece of equipment for sure you should have. You should also have a scale. A lot of people, we're here to lose weight, but when was the last time you got on the scale? I don't get on the scale. I'm nervous. I'm afraid. Well,
I go to the doctor and
right?
I hate that question.
Right.
You get on the scale, and I saw about 3 doctors one day. When you get on the scale, I said, please don't ask me that one more time. That scale, right?
Yeah, but we should be monitoring it, so it's not creeping up on you before you know it. You up 20 pounds and you trying to figure out how it happened. So we should own the scale, at home. Some of the other things may require prescriptions, like a glucose monitor.
Oh, that requires a prescription?
Yeah, I believe at least maybe the test strips. I'm not sure if you can just buy it over the counter. If you can, that would be great. But interpreting it, you may need a little help with that. Your cholesterol and all those things, that's a blood test, so you may not be able to pick that up. But definitely a blood pressure monitor and a scale.
Now, one thing I started doing in probably 2017 or 18, 16, or maybe 15 or 16 or something like that was I started going to a holistic medicine doctor. And one thing I liked that they did is it reminded me of the old school. They withdrew about 4 vials of blood.
Yeah.
and they gave me a report, looked like a financial plan projection.
Yeah.
And they talked it. I guess they tested they tested my blood, they tested my organs, my bones, my tissue. They did all of these things that the doctors don't do.
Yeah.
And I was like, I told my mother, like, wow, this is interesting, right? This is what the doctors used to do. So, like, when I go to the West Side Market, that's what the grocery stores used to look like, right? With a whole hog or pig in there. And I was like, wow, that is so interesting. So, I almost use them as my primary because they are really, and then the interesting thing, they don't wear white coats. Is this the reason why my blood pressure is 122 when I go to them? It's like, that was interesting. I went like last week and my pressure, they said, oh, it's 122/80. And I'm like, that is so interesting.
The pressure's off, right? You have different expectations walking in that sort of practice. You know they're not going to, push medications on you. The environment may be more friendly. And you may actually be paying out of pocket for that sort of service. So that's the major difference, right? So your doctor is not going to be reimbursed for a lot of that. So they're not going to order it. You're going to be sent with a bill. We can draw it. We can absolutely draw it and order it, but you're going to have a high, bill after that. And so, some of the, like functional medicine is, known for some of this where they do an in-depth analysis on your labs and things like that to provide you with a little bit more insight. But again, that's not reimbursable. And so that's why your doctor is not doing that.
And then, so like I had some doctors, they would review that and give me feedback and say, well, yeah. Then some of them say, well, no, we have to do our own testing. And it's like, oh, wow. I mean, who do you have a problem with here? Who did the blood work or what? But, I think I do it because I like having that once a year to let me have a baseline of, what was going on. And it just reminds me of that's the way the doctors used to do because like you said, when you got here this morning, you had taken your son to get a physical.
Yeah.
And when I was younger, I played sports and we had to get a physical. And I remember they used to do all of these things. And so, especially when I get older, and that kind of takes me back to when you said that a lot of these things should be done like when you're in your 40s.
Right.
And it's like, for me, that was too late. When I was about 31, going up the stairs in my house, so you should have a blood pressure kit at home and you should have some stairs.
Well,
because those stairs will tell you a lot about your cardio and your needs.
Well, when patients present with the issue, it's in their 40s. We should be doing these things as early as possible.
Yes.
So, like I mentioned, I took my son for a physical this morning. Some of the first questions from the doctor was, tell me about how often you're getting physical activity. Tell me about what you eat in a typical day. What are you drinking? How much sleep do you get? So they're starting early to ask these questions. When the problems present themselves, these are the patients that I see.
Yes.
40s to 50s. But absolutely, we should be teaching our kids, reinforcing this in our teenagers, continuing our habits in our 20s so that we don't get to our 30s and 40s and 50s. Now we got to do
this big lifestyle change.
Exactly.
Because if you train yourself to have one soda a week or something like that, and you start realizing I need to cut back on these things, or walk at lunch or something like that in the summer, or walk, on the weekend or something like that, it does help. It helps to get it in. And then, too, you start finding buddies that, walk and do these different things,
Absolutely. Too. Yeah. So, we want to be reinforcing lifestyle habits as early as possible. Yeah.
So, talk about how you even got into all of this, right? As kids, we all grow up and we want to be a particular thing.
Yeah.
And I think it's always interesting when, I meet someone like you who from go wanted to be this, and that's all you ever wanted to be. That's all you still want to be.
Right.
Whereas people go to college, they got about 12 majors, and, they keep repeating, and the parents are like, I'm done. I did 4 years of tuition. You're on your own now.
Yeah.
How did you get into this?
I always wanted to be a nurse. I was always fascinated with the medical profession. my earliest memory of this was actually being excited about going for my own well child checks. And I'm embarrassed to say I would love to actually get those immunizations and shots because I just like to see the whole process.
Wow.
And the, and the hustle and bustle in the office. I just wanted to do that. Like, I want to be a nurse. And I just knew. And fast forward, like they said, what do you want to do in school? I want to be a nurse. So that was the profession, that I pursued. How I found myself in weight management, it just kind of found me.
Yeah.
When I started out as a nurse, I worked with patients after they had bariatric surgery.
Yeah, okay.
And helped them in their post-op recovery, would discharge them home, and I really wouldn't see them afterwards because this was on a medical surgical floor. But once I went back to school some years later to pursue my master's degree and to become a nurse practitioner, there was this opportunity to return back to bariatric surgery and to weight management. And I had fond memories of that, And so now it was my opportunity to actually see patients on both ends of the spectrum, what got them to this point to need or to undergo bariatric surgery, and then how their life changed after the procedure. And what all of that looked like for them. So it's been very rewarding, almost like full circle for me. And from there on, it just kind of took over. Like I said, there was such a need out in the community, which led me to my Sister's Keeper, that organization that I'm involved in, where I do nutritional counseling for those diagnosed with cancer. There was such a need for people, for our people especially, to fully understand, not only what this diagnosis means to me, but, what eating, habits or what nutritional interventions can I undertake in order to, feel better. And so I just use that expertise and that knowledge, to assist in that organization and that platform.
And then, so with My Sister's Keeper, again, the CEO and founder of that organization was on about a month ago. And so talk about like the program, because you do a monthly, or do you do biweekly, or do you do a monthly program on with your nursing and weight management?
Well, yeah, it's a consultation basis. The
people
particular,
sign up,
so people sign up.
Okay.
They sign up for My Sister's Keeper, and they opt into a nutritional, consultation, with me. So I just simply give them a call, introduce myself. We talk about kind of what their treatment is, kind of where they're at with things, and then what questions they have. Undergoing cancer treatment, it could be pretty hard.
Yeah.
You got a lot of fatigue, you got a lot of taste changes.
Yeah.
You're not feeling well, a lot of nausea, a lot of, gastrointestinal issues. What can I tolerate? What can I do? And then the biggest question is, did I do this to myself with my lifestyle? What can I do to prevent this or, in the future? So there's really, like a motivation to really make a, lifestyle change with their nutrition. So I answer those questions for them. Like I said, a lot of us just really don't know. We don't understand how the body even uses food. What does all this mean for me? So how can I put the healthiest meals together? And so I answer a lot of those questions.
Okay, and so then, like, what's the difference between like your regular day job and then when you're someplace like My Sister's Keeper, where when people see you, do they, especially African American women, do they, is there a different type of dialogue and feeling, because it's like, okay, wow, I can talk to her, she'll understand.
Yeah.
Internally we may be thinking that.
Yeah. Well, I'm LaTonia here, there, and everywhere kind of
But I'm
thing.
saying when people, how do, when other people see you, do they feel more comfortable in different environments talking about their health or something like that?
Well, I would say with my day job, I more so function as the clinician, where we're going through that whole assessment, evaluation, figuring out which, intervention we should go in order for you to lose weight. Out in the community, it is more so a little bit more relaxed, a little bit more I say daughter sort of
Yeah, okay.
kind of conversation.
Mhm.
You know, I talk to you like you're my mom, like
Yeah.
you're my sister, like you're my
Yeah.
aunt. You know, as a real family member, you know, what does this really mean for you? Really just and not too technical.
Right,
You know,
right.
I think
That's
it's
the big
important.
thing.
Yeah,
Yes, that's
it's important to just be real, to be transparent, and just basic information. What are some basic things that we can do to help you feel better? And really just making those small tweaks. You know, for most people, they end up, you know, doing better and
okay.
making some adjustments that they can stick with. But yeah, the differences, I guess the major differences would probably be the education.
Yeah.
So in like the community, obviously I'm not prescribing, I'm not ordering things and that sort of thing. I'm more so educating.
Okay.
Mm-hmm.
And then too, though, if with my sister's keeper, the organization, its mission is to help women, go through the process who have cancer.
Right.
And so they definitely have more of a, understanding about why they should be losing weight and how these different things are going to affect them ultimately.
Yeah, and it's,
because if you're at the hospital, sometimes people may just want like a quick fix or something.
Right. Well, and if you're actively undergoing cancer treatment, you may be losing weight and not even be on purpose trying to lose weight. And so sometimes the conversation is about weight maintenance and just overall nutrition.
Yeah.
As a matter of fact, that's most of the conversation. Okay. I never try to push on someone you should be losing weight.
Yeah.
That's a personal
I'm glad
decision.
you said that though.
Yeah.
Because what is weight management? Because that is so important that you said that. So when, again, I'm just thinking like when I go to the doctor, when I go to a hospital, when you see these initials, we don't know what they mean. I know I'm seeing this person. This is the doctor. Did she talk to the doctor? And then so with weight management, I'm glad that you just clarified that it's not telling people you need to lose 5, 10, or 20 pounds. It's more about understanding what the food and the things that you're ingesting.
Yeah, I kind of take a more personalized approach because, like you said, the first thing that happens when you walk in the office is get on the scale, right? Get on the scale and what's your height, right? And we may or may not want to, do that, but that's our form of measure in the hospital, and we come up with this BMI. Right.
We said we were going to talk about that. BMI. Yeah, that's under attack now.
Yeah, the body mass index.
Yeah.
And so how I try to approach the conversation is, okay, let's take a step back. Do you want to lose weight?
Oh, I like that.
Yeah.
I like that.
So if you don't want to lose weight, okay, maybe you want to maintain, maybe you just want to eat healthier. Okay, but let's think about it in more so what medical conditions or complications do you have that could be weight related? So for instance, like you mentioned, my cholesterol was creeping up, right? So that would be an opportunity to talk about not your weight, but your overall lifestyle and your diet. It may result in weight loss, right? And oftentimes,
dipping them in buffalo sauce.
And oftentimes, with the weight loss, that will improve. But overall, the overarching goal for you is actually to lower your cholesterol. So that's really, really the goal. And that's kind of how I like to frame the conversation.
Okay. Yeah. Okay. So everything. Okay. So it's not about losing pounds. It's about what you're eating, and because for me, that's something that I've done for like decades. Is just constantly, cut back on different things. Right. And I think the biggest thing that I've learned is by cutting back and changing things is with drinks.
Right.
Like yesterday, I got to the theater. I wanted a tea. They only had one brand of tea. I was like, oh, we definitely can't do that. So I went to the concession stand, and they said they had like a cold tea. I said the one with 47 grams of sugar, I think, in it. I was like, let's see how long I can survive without that. Mm-hmm. And so it's like one thing I would always tell my mother and my sister. If you stop drinking those sodas and things with all of the sugar or the salt, you will realize the excess amount of sugar and salt in things, because when you go back to eat them, Like when I cut out sugar, I remember I was working at a golf course. I got there and I got hungry, got a Reese cup or something. And I felt like I was about to go into a diabetic coma right there. It was like, wow, I was overwhelmed with the sugar.
Yeah.
And so I think that that's a big part of it too. Like you say, is understanding what you're ingesting and, just slowly but surely getting things with 10 grams or whatever, all of those. Reading, first of all.
And I was just getting ready to say that. We're going to start with just reading the labels. Yes. Yeah, you mentioned 47 grams of sugar. How many people know what that even means? Where to find that information on the label, and how to calculate that. Is it 47 grams for the entire container?
Right.
Is it 47 grams per serving, and the container is 2.5 servings? So then therefore it's 47 times 2.5.
Right.
Which means it's even more sugar than you originally thought. So I spend a lot of time on educating people and understanding how you read that label. That makes a difference, because you could be thinking, oh, I've been doing pretty good. I only have, I have one bottle of this, but that's 2.5 servings in that bottle. So starting there really makes a big difference. Yeah.
Talk about the BMI. Isn't that under sort of I think it's going through what the mammogram went through, right? Like, we need to get rid of that. We should not be using that. And this summer, that started to creep up.
Yeah, and I'm so happy it's finally gaining attention, because it's long overdue. We really need to, come up with a different measure. We got the BMI because it's cheap and it's easy.
What's BMI?
And it's something
what does
that
it stand
you can
for?
do in the office. So BMI stands for Body Mass Index. It's a calculation based upon your height and weight. That's it. And that's truly it. And the reason why it's come under scrutiny now is because it was based on population studies by white and Scottish men. So therefore, it doesn't translate to the rest of the population. And so we're really looking at, okay, what other forms of measure can we test and use in order to see, is this person at risk for some sort of disease? And that's the whole point of the BMI. It helps us to, classify and come up with disease, risk, and those sorts of things. But yeah, sometime in the 17 and 1800s, they came up with this measurement, again, largely based on, Scottish white men. So as you can see, that leaves a lot of people out, people like me and you.
Yeah.
And they established this body mass index, to look at populations. It doesn't account for water weight. It doesn't account for muscle. It doesn't account for fat, or bone, and so, which is why it's not the most accurate. Okay, and so you could, quote unquote, have a higher BMI, but not necessarily have obesity, if that makes sense. And so we're looking at, other ways in which we can get other information, waist circumference, body mass in terms of fat mass, and trying to get a more accurate picture, for people. For now, that's all we got, So I tell people, take it with a grain of salt. Don't put too much weight into it, no pun intended. And so it just kind of is what it is for now. What is your best weight? What weight do you feel your best and your healthiest at? That's free of disease, or at least as controlled as possible. So for you, like you mentioned, the cholesterol, would it improve with a 5, 10, 15 pound, weight loss? I don't know. Would it improve with just changing some, things with your lifestyle, but you for the most part stay the same weight? I mean, ultimately, that's what it's really about. Okay. And so that's kind of how I would use that information and really kind of look at the whole picture and coming up with a plan.
Okay.
Mm-hmm.
Okay, yeah, because I know I saw that. I think people, we hear these things, they get kind of trendy,
Yeah.
and we kind of, jump on board, and we don't really understand what it's about or anything like that. Other people are talking about it, and we don't have this clear understanding. Again, you listen to the BlackAnthropy radio show produced by NoStaticRadio.net out of Cleveland, Ohio. And today, my guest is LaTonia Ford, nurse practitioner and weight management specialist. Weight management is not about getting people to lose weight, but understanding what they're ingesting. So that should be like a good tip for today and for our lifetime, is to remember that when someone's getting, asked and clarify when someone talks about weight management with you, what are they talking about? Even when you go into a medical setting, period, understanding who the professional is in front of you and what options are out there in addition to in addition to a prescription pill or something. I think that one thing that really gave me a lot of reservation with taking prescriptions is what you just described with the BMI, is listening to and reading a lot of stuff. It talked about the prescription drugs are based on um, you know, testing on certain types of people.
Right.
And I've always wondered that. One of my golf buddies, he's a chemical biologist and chemical engineer,
Yeah.
and he talked about. And I said, so why don't they, instead of giving everyone the same pill or option of pills, why don't they take the time to learn and understand who you are and base what you should be doing off of who you are and maintaining your charts and records based on that versus giving you a pill based on studies of a rat or a group of people that may not be similar to you or something like that.
Yeah, well, even with that being said, there's still, like you said, so many limitations. A lot of studies are based on mice models, rats and, apes and things that they, test these medications and interventions out on. And then the human studies, there's limitations. They're only on certain groups, only on certain ages, So even when they do make the recommendation, there's still, limitations. I have to admit, just a lot of us don't really sign up to be participants in research studies either, right? So we kind of part of the issue, right? If you don't participate in research, then this is kind of, what you get,
And that's one reason why, again, the lifestyle change became important for me. And so then, and the thing that I liked about the stuff that I was reading and listening to, a lot of interviews that I've listened to over the last 25 years, is next thing that I want to bring up with you. They didn't just talk about these things and say what the issue or concern was with them. And they talked about the lifestyle change thing and the thing that they do and the people that they see. So talk about like gardening, how now it seems like it's fashionable.
Yeah.
Whereas I'm sure for someone like you, again, as a weight management specialist, you have been aware of these things, and these are things that are not new.
Right. Well, there's starting to be a shift in medicine to fully appreciate, some of the return to gardening and counseling patients on whole foods and just regular physical activity. It doesn't necessarily have to be a full-fledged, even gym sort of thing. Just how can we be even more, physically active? They call it lifestyle medicine. So there is a shift, to that. Providers are being educated. There are certification programs on it. Again, they're trying to incorporate it in medical and nursing schools now. So it's slow, but it is coming. Okay, you may even notice with your own providers, they're trying to have different types of conversations. They're trying, with their patients as opposed to just writing, prescriptions. There is a shift. People are becoming more informed. There's videos and all kinds of how-tos on how to do some of these things. People want to take more control of their health. And I think that's important. And that's where it starts, right? What can I do, in order to take care of myself before it gets to the point where I, things are out of control.
And then what about, like, people may not see it like this, but like, again, this morning you took your son to the doctor. You're almost like an advocate for it, so that if it's something that he doesn't understand or later on doesn't remember, or something the doctor recommends or suggests to him, then it's almost like taking someone with you that is more comfortable. Like my oldest sister, she's kind of still out with me on this, because I would go to the doctor with her, and then the last time she wanted me to go, it's like 8 hours away from me. She's in Rockford, Illinois, and I'm like, okay, I can't come there just to go to the doctor with you for a 10-minute appointment.
Right.
But talk about the importance of, if you're not comfortable, if you don't understand, you should always walk away from these appointments having some understanding, and or someone that you can talk with. And if you feel like you are, walking away a lot, not understanding the importance of taking someone with you.
Taking someone with you, or even doing like a semi-video chat. So maybe if you couldn't drive 8 hours to be with your sister, maybe she, puts you on FaceTime or something while she's in the office with the doctor. So then that way you both can hear it, and obviously this is with the permission of the provider as well.
Right.
I think that would also be helpful. You're right. We use a lot of medical terminology that can go over, your head, and you got a lot of questions, and maybe you're not even realizing it until you're out of the office, but having somebody there to advocate for you, to ask those questions, to be of support, can really make a difference.
Okay, yeah. So, and then let's just talk about this. So far, you've been, you've always had a passion for doing this work.
Yeah.
And you've been doing it for 18 years.
Yeah.
So talk about the changes that you have seen. And I think as we've been talking, you have been talking about a lot of things that are coming forward. And that's really good to see, because I think it, kind of, highlights to people that these are the things that when you go to the doctor, are these doctors and these nurses, are they talking about these things that you're saying they're starting to do now?
Yeah, there's a big shift. It's exciting. Over the years, when I first started nursing, we were paper charting. Everything was, doctors were writing orders and they had to be put in by the secretary. I was once a secretary putting the orders in. So to see that shift and that explosion in technology, I want to say is probably the most exciting. Now, like I said, you can have these visits, virtual and telehealth, telemedicine sort of visits with your provider, so you don't have to take time off work.
Yeah, that's true.
Yeah. I mean, there are some limitations in it, obviously, but if you got a quick question, or you want to have that conversation, some providers even allow you to even chat with the office. So that communication, hopefully, is opening up with technology. Again, like I said, there's a big push to move more so towards lifestyle medicine, to really, really support the patients in improving their health, because we're really starting to see that's really where it starts.
Yes.
Okay, and that's really where you're going to make the largest impact. We're not doing so well with just prescription medications. We're not doing so well just with surgeries, with some of these medical conditions. We really need to educate and support our patients on lifestyle modifications. So even if you do have to take that medication or had a surgery, what are you doing after that to hopefully prevent that, because it's costing our health systems in our country billions of dollars. So I'm hopeful. I'm optimistic. Again, I see patients, just like you, educating themselves, seeking alternative treatments. And I like the fact that you actually took that lab result, to your primary care doctor and shared it with them. That's important. They may not completely agree with it, but maybe they can offer you some insight. But I think we can all work together. I think we can all collaborate. There's no point in being in competition. It shows you taking accountability and showing genuine interest in your own health. I don't think there's anything wrong with that. I'd rather you ask, and be
Right.
open and upfront with it
Right,
than to, not, and, unfortunately something, bad happens. So yeah, that's kind of where we're going in healthcare, and yeah, I'm optimistic.
And one last thing I want to bring up is the actual prescriptions.
Yeah.
So here we have Mac Pharmacy, if you're familiar with them, and they're one of the doctors. He used to be a pharmacist at one of the major hospitals here, and he kind of encouraged his buddy to start the pharmacy with him.
Okay.
Independent pharmacy. And the thing that I like about it is it was something that you said earlier, the doctor, they got all these patients, it's just you, and they don't really know you.
Mm-hmm.
The thing that I like about when I spoke with them for an article that I did, because they stepped up big time in the Glenville neighborhood, which is a predominantly black neighborhood,
absolutely.
when the Rite Aid closed. And so the thing that I like, when I went in and spoke with them, they constantly were talking about bubble wrap, bubble wrap, bubble wrap. And I'm like, please show me what this is. So they take the medication and they color code it by morning, afternoon, and night.
Oh, okay.
And then it almost looks like, like it's the length of like a sheet of 8 by 11 paper, and it's perforated. Okay. And so you can just peel off what you need to take for the day in the morning or the night or whatever for the month. And you don't have to get your bottles and read it and say, what's this and what does this mean? And then not only that, they also do like consultation with the patient, like, well, I think you should take this medication by itself to get it, more concentrated because it's not giving the effect.
Yeah.
And so they were like, yeah, we have people have multiple doctors for one pharmacist.
Yeah.
And so I thought it was just really fascinating, the approach that they're taking on, assisting people and helping them understand the medications that they're taking.
Yeah, that sounds fantastic. I'm going to have to look up
Mac Pharmacy.
Mac Pharmacy,
yes.
Yeah. So
they have 3 locations. They have one in Akron, Ohio. They have one in Cleveland somewhere. They have one right there in Glenville on 104th at the corner of 104th or 105th at St. Clair. And then they were looking at opening one in Lorain, Ohio.
Yeah, and so healthcare lifestyle, it extends outside of the hospital, right? Outside of the doctor's office, like you said, with your pharmacists, with your other professionals that you may be working with. We're all supposed to be one team, and so what it sounds like that pharmacy is doing is that helps with compliance. A lot of people get confused on what time of day do I take this?
Right.
Can I take this with that? You don't really have a lot of time to ask the doctor that when they're in the middle of writing a prescription and sending it to the pharmacy. You may not even think about it. And so they're, extending that education into the pharmacy.
And not only that, they deliver because they understand that, for the most part, so like you said earlier, older people are taking medications. They don't have transportation and all of these other things. So they deliver to people. They do follow-up phone calls. And when a person says, well, I didn't take my medicine. Oh, I'm not due for a refill. They're like, well, you are. And when the people are not, they're saying, how many do you have left? So it helps them to understand what the person is taking. And again, it's another level of understanding your health because they're saying, you're taking this medicine because of this. And if you're not taking it, this can be the result.
Yeah, and it's a shift to more of a relationship. Right?
Yes.
I think that's kind of what we've been missing.
Yes.
We're seeing a lot of people, but do they really know us?
Yes.
Right? Do they really understand us? That's kind of what some of the gripe has been with some of the health systems and interfacing with doctors. So they bringing it back home, right?
Yes.
So you feel like this person really understands me. They have my best interests at heart. Back to that relationship sort of feel like we used to have. So that's important.
Yes. Mm-hmm. All right. Well, that's going to be it today for the BlackAnthropy radio show. Yeah. Unless you got something else you want to talk about. Yeah. Yeah, your community work, you volunteer a lot, and so you get these people, like I say, with these PhDs or DHDs. I mean, they're out there. I mean, they have that passion. I really learned that, that's what a PhD is. That immersed study on one particular topic, and it's like, wow, that person has a lot of passion and commitment to that profession, to want to take 2 or 3 years of your life and do nothing but, delve into that.
Yeah. Thank you so much. Thank you so much for having me. It's been nice. It's been fun.
Yeah, we're glad. Again, that's why we started BlackAnthropy, to let people come in and tell their own story and not me sit up here and hullabaloo for 2 hours about, what a nurse practitioner is and whine and, about my experiences with the doctors. Have people come in, talk about their profession, and then people can take that because you're the expert on, your finances. You're the expert on your health. But, to have people come in and talk about it versus me making up a whole story about it. So I really appreciate you coming in and sharing this information. It's so valuable for our community. And again, thank you so much, LaTonia, for coming in, nurse practitioner, weight management specialist here in Cleveland, Ohio. You can go and sign up for one of LaTonia's sessions with My Sister's Keeper.
Yes, thank you.
MySistersKeeper.org, wonderful organization. They have so many resources for women, and they're expanding to men as well. So, again, thank you so much, and that'll be it for BlackAnthropy today, this Monday, August 21st. Thank you so much for listening. Take care. Bye-bye.
And I be going so fast.
I told you.
You was great.
I told you.
Yeah.
That's why I told when I sent you that thing.
Yeah.
Because you can get into different things, and then you kind of
We'd like to thank you for tuning in to BlackAnthropy here on the station where we don't bring no static, but we sure enough bring the noise on staticradio.net. Make sure you guys check us out on social media where we absolutely love to hear from you on Facebook.com/No Static Radio LLC. On Twitter, also known now as X at No Static_radio. On Instagram at TheReal_No Static Radio. On YouTube at No Static Radio. And our newest platform, Discover.tv. Also, you guys can listen to replays of this show and all others on the platform at Mixler.com or Mixcloud.com. Just type in No Static Radio on the toolbar for replays of this show and others, and for continuous streaming uninterrupted. Please check us out on TuneIn.com, LiveOnlineRadio.net, or MediaQ for continuous streaming, like I said, uninterrupted of this show and all others on the platform. And for all things No Static Radio, including up-and-coming events, merchandise, and an in-depth look at all our great show hosts here, please check out our website at www.nostaticradio.net. Thank you guys so much for tuning in. Stay tuned. You know what it is. It's Monday. It's a Mind Day Motor Monday. And coming up at 2 p.m., we got Hustle and Wax with the Hustle and Wax Flow. Later on, followed by Drag Race and the Ultimate Sport, and more than meets the eye. So we got a lot for you. You guys stay tuned. You know what it is. In the meantime and in between time, we got more music for your listening pleasure here on Your Voice of the Revolution on staticradio.net, powered by Google, partnered with Colors, and sponsored by Lamont Avenue Wines, the Cleveland Rugby League, and Design Me exclusively. Guys, be safe. Don't go nowhere. We'll be right back.